few small stories that I thought would be of interest to discuss tonight. The first are for patients that are taking tamoxifen or have taken it for breast cancer treatment. And some folks, and I definitely have patients that have been on tamoxifen for a long-term treatment for cancer. They are finding that there may be a correlation with premature tooth loss. So as clinicians that are doing our health history and intake and correlating what we see clinically with helping patients understand risk assessment, if they've had a history of tamoxifen or, are currently taking it, there may be some correlation for them to worry about an increased number of teeth that won't survive for their life expectancy. This particular study came out of the Med-Oral Patol Oral Circle Buckle, which is out of Peru. I'm sure I totally slaughtered that. But they were looking at the correlation.
Buckle?
Yeah, I did.
Is that like around the buckle circumference?
It's surbuckle or
Okay,
curbuckle.
just want to make sure. Okay.
Yeah, I totally butchered that. Out of Peru, looking at correlations between premature tooth loss and the use of tamoxifen. So perhaps there'll be future correlations that we may see. I do think it's always interesting that we don't give sex hormones enough credit for the roles that they play and many of the other pathways within the human body. We think of them obviously with estrogen, progesterone, and testosterone as primary sex hormones, but they have a tremendous responsibility in the human body for many other pathways. Ask any postmenopausal woman, and they will tell you that for sure. So it would not be surprising to me if a drug that has direct responsive reaction to estrogen in a woman's body usually, but guess it could be used on men as well for breast cancer, that we might see that there would be negative sequelae that may come from that. So certainly something to continue to watch. The only other kind of interesting news, I guess, that came out of this week, Ohio lawmakers have actually been working and busy. So congratulations to Ohio. I'm not sure any other governmental agency is actually working right now. Good or bad, not sure. But Ohio was busy this week with passing two particular bills. The first bill was that they have decided to join the Hygiene and Dentist Compact. So they will be participating with many of the other states now that are on that compact for license portability. So, they've already hit the critical threshold of the number of states that needed to be a part of the compact in order to start making their own regulatory decisions and decide what this would look like from an actionable level and how they would provide license portability. But additional states continue to join and want to be a part of the conversation, Ohio being the most recent. They also passed a second law related to dental benefits this week, more specifically correlating non-covered services for dentists and allowing dentists to be able to receive compensation fairly for services provided that are non-covered services. They wanted more clear language on how dentists can bill for those services that are not covered by insurance. I think we may talk a little bit more in detail about that tonight with our controversies discussion, but that is always a hot topic for most dentists. If you're doing elective treatment, you want to do 20 veneers, you want to do complex fixed hybrid work, etc., that is not routinely covered by a patient's $1,500 annual maximum for dental benefit, and yet you're unable to accurately bill a patient for the services being rendered. I think states are trying to reconcile this particular gap in the code and also to help dentists be able to provide the appropriate care for patients when requested and as needed. So good job, Ohio. You're coming on the heels of Florida, who also passed very similar bills most recently, not the compact, but non-covered services bill as well. So with that, that's the news.